we're probably averaging between 10 to 15 interventional procedures and talking about 550 to 650 acute procedures per year. I think the volume of work has increased over the last decade for a couple of different reasons. I think particularly the awareness of heart disease as a major healthcare problem has become more prevalent in Tasmania, particularly here in the north and northwest, which we've always had a high prevalence of disease. But now the assays that are available to detect early disease on our screening test have become more and more sensitive. So when patients present to the hospital with chest pain syndromes, which is quite common, the blood tests that we do, the assays that we do, become so sensitive that we're able to detect disease that 10 years ago would have been missed and patients would have been discharged home. So I think that we are just detecting disease earlier than we used to. If you look even worldwide, the average age of a cardiac patient with an acute cardiac event will be somewhere in the mid to early 60s. That's the average age, but the range is all over the place. And in fact, last week, we had a 28-year-old on the table having a heart attack who needed to be fixed, followed by a 32-year-old and a 37-year-old. This was literally within 2 and 3 days apart. So heart disease doesn't just afflict older people as a natural history issue. It's prevalent in all ages, and we've seen many patients over the years in their 30s who've had fairly extensive disease. It's almost a shock to those of us who are past that age when we reflect back on what we're dealing with now.